Hello and welcome back to another episode of the Newbie Dentist podcast. I'm your host, Dr. Omid Ezami. Approaching the big 50th episode soon, and this little project that I started to connect with and speak to dentists from all around the world has really grown into something that I could have never imagined. I will be announcing the first sponsor for the podcast in next week's episode, and I'm excited to continue to improve on the quality and quantity of the interviews for you guys. I must thank everyone for the overwhelming support over the past year. It's definitely not easy to start a podcast in Canada and then move to the other side of the world to Australia and still retain the listener base in Canada and the United States, all while building the Australian listener base. So again, I just want to thank you everyone and send out my sincere gratitude to each and every one of you. In this week's episode, I sat down and had the great pleasure of interviewing Dr. Aniko Ball, who is a dentist in Melbourne, Australia. After decades of working with chronic neck and back pain issues, Dr. Aniko got passionate about ergonomics and founded Optimum Dental Posture, which is a course and seminar that runs several times per year here in Australia. Optimum Dental Posture's mission is to reduce the incidence and occupational musculoskeletal disorders in dentistry and to send a message of hope to dentists for recovery and prevention of pain and discomfort. And in this episode, she is super generous with her time and shares a lot of valuable information about posture, ergonomics, and dental loupes. As always, if you guys enjoyed this episode, please be sure to share it with your friends, classmates, and colleagues. All the links and the information that we talk about in the interview can be found on the show notes. I hope you guys enjoy this episode.
Hello, and welcome to the Newbie Dentist Podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Newbie Dentist Podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Ezami.
Okay, so I'm here with Dr. Aniko Ball, who is a dentist based in Australia who's done a lot of work with dental biomechanics, ergonomics, dental mindfulness and well-being. And I'm really excited to kind of dive into a lot of topics with her today. So thank you so much for coming on.
It's my pleasure. Thank you for inviting me.
No problem. So what we normally like to do in this podcast is kind of start off with a bit of an origin story. So if you can kind of tell us about, where you grew up and what made you get into dentistry and then your experience in dental school, because we actually went to the same dental school. I know we graduated a few decades apart. So I'm actually kind of excited to see what it was like when you were going through.
So I grew up in Budapest, Hungary, and came to Melbourne as a 14-year-old with no English. And it was a tough journey. And luckily, I studied very hard and got into the Melbourne Dental School and graduated in 1976. And what I learned in dental school in my fourth year, because I don't know if you still have to do a research project in your final year, but you do. So mine was on fearful patients, phobias, and through that I came across research that told me how high the stress, burnout rate, and suicide rate was among dentists back in the 60s. So I thought, oh my goodness, I'm about to graduate into a profession like this. So I trained extensively in how to take care of myself and calm my patients through hypnosis relaxation techniques. And that was amazingly helpful, and it kept my sanity, and I was very successful with my patients. What I didn't learn was how do you get this pair of eyes and hands over to the patient's mouth without twisting myself into a pretzel, which I did. Yeah. And I was suffering chronic neck, back, shoulder, everything hurt kind of pain for decades. And that was completely missing.
Yeah. So what was it that made you want to pursue dentistry in the first place? Because I imagine, especially it's hard enough now with all the technology and how comfortable dentistry has gotten over the years. People still don't like to come see us. So I can imagine only back then, it would have been a pretty challenging profession to kind of get into. What drew you to dentistry?
I was always very interested in helping people. I had no idea how challenging dentistry is. And at that time, there were very few female dentists. A few years earlier, there's only one in a year of 30. And when I first started working in practices, people were convinced that I was the dental nurse. So it was challenging. I thought it was a fantastic profession, especially for a woman. I was planning to be a mother and wanted to be able to work part-time and also look after family. And I thought it was a great profession, but I just didn't realize how demanding it was on my body.
That's great. And that's a great point. I didn't think of that perspective and we've come a long way, certainly in that regard as well. I think probably 50%, 60% of each cohort now is female. So I think it's gone from maybe 1 or 2 per class and now it's majority. So it's been great progress, I guess, in that regard as well. Tell me a little bit about the clinical side of dentistry for you. When you first started graduating, what was that like? Did you have many challenges in the workplace or?
Well, it was challenging. Even though we worked in student clinic, it was very different to be out in private practice. And so the time pressure and working with different instruments and equipment was challenging. At that time, there were a lot of jobs. In fact, young dentists were interviewing prospective employers.
That would be nice.
So it was a very different scenario. Yeah. And I was practicing for about 10 years exclusively in general dentistry, and I incorporated my hypnosis and relaxation into my work, and I saw a lot of very frightened and phobic patients.
Yeah, that's great. So I think there's kind of 2 sides of things, and I want to start off with the biomechanics and ergonomics side of things for today. And if there's time, it'd be great to talk about the hypnosis and the managing burnout and stress and things as well. With the biomechanics, ergonomics, obviously that's huge. Dentistry, I mean, I kind of come from an exercise physiology, kind of physio background myself a little bit from my undergrad degree. I'm playing sports my whole life and things. So I've always been very aware of, posture and injuries and learning to kind of assess my body and see, oh, that's not feeling right, or this is tight, or that's not in balance. And dentistry is very challenging. What I've been doing is at least like 3 times or once every month I go see a massage therapist just to kind of get all the knots and stuff out of my back, because there's those like trigger points that I guess we all have like in our traps or in our mid back or wherever it may be. And it's very tough, especially with, we're wearing loupes, we're working in tight spaces. And I'm left-handed as well, which also creates like a lot of challenges, trying to fit into the dental workflow. And because a lot of rooms and cabinetry and chairs aren't really set up for left-handed dentists. So I don't know what the best way to approach this is. Maybe if you kind of just tell us about, what you find is the most challenging issues that dentists are facing right now with their posture. Kind of pick and choose a few things and kind of go from there.
Well, let me start with the fact that, and this is something I came up with, is I have made a distinction between outer and inner ergonomics. So I call outer ergonomics everything but the operator. So the surgery layout, the patient chair, the stool, the equipment, every bit of equipment and instrument, and they're very important, including the loupes. I call that outer ergonomics. Mm-hmm. And I must say, sadly, that a lot of what is called ergonomically designed isn't, and I've been investigating many of the products. And then what the dentist is doing inside himself or herself, the way we hold instruments, the way we sit, how we bend over the patient, that is just as important, possibly more important than the outer ergonomics. And I've called that inner ergonomics, organizing yourself from the inside out, knowing what your body is designed to do and what it isn't designed to do in movement, but especially posture. Yeah. And we hold postures for prolonged periods. And that's the challenge in dentistry. So I come from that.
Okay, perfect. So I think this is a great distinction. And so let's start with inner ergonomics first. What are people doing right? What are people doing wrong? What do we not even know that we're doing wrong?
Okay, so a lot of this belongs in the area of you don't know that you don't know. Some things we know that we don't know, and know how to learn. So what most people don't know is basic functional anatomy. I call it inner ergonomics 101, and it's not rocket science. There are 2 points. Where your important joints are, so not all your joints. Yeah. And what research has shown is that if you have a faulty picture, location of where an important joint, such as your hip joint or your arm joint, or where your head sits on top of the spine, you move according to that faulty location in your mind and injure yourself. So number 1 is where the important joints are, and just a few. Yeah. And 2, which joints are designed for bending and which are not. How simple is that? Yeah. And that's what I'm finding missing, not only for dental students and dentists, but I've even had doctors and ear, nose, and throat specialists in my training programs And they can operate on a patient, but they don't know in their own body where those joints are and what they're capable of. And that was missing definitely in my training, and I believe it's missing in most dental schools.
Yeah. And so what are the most common joints that are, I assume the neck would be the main one. What other joints are there that we need to be paying attention to?
Well, before we move on from there, let me say this, and this, you'll be surprised how simple it is, but this makes the difference between having a career that's painful and cut short possibly or not. Yeah. So the head sits on top of the spine at the height of the ears. Most people think it sits lower than that, just because the neck seems to be further down. So if you imagine a rod going through your ears, that's the axis of rotation for the head to look up and down.
Wow. I'm sitting taller as you speak.
Now, looking down, the head has only about a 10-degree freedom to look down. And when we come to loupes, that'll be a very important point.
Yeah.
So below that, C1 and C2 is where the head can turn left to right. And then, and this is a very important point that no one seems to know, and I certainly didn't until I trained further, is that every single intervertebral joint below C2, all the way down, is a gliding joint.
Yeah.
And there is not a single pivot or hinge joint anywhere, all the way down the spine. And yet, we, and especially dentists, use their bodies and bend as if there were hinge and pivot joints along the spine, and there aren't. So this twisting forward below the height of the ear and beyond the 10-degree with the head, and certainly twisting off to the right for right-handed dentist, left to the left-handed dentist, that is a disaster for the spine.
Yeah, I find that myself, I'm always like leaning towards one side because you favor, I guess, whichever side that you're sitting on and working on.
And let me state that gravity never moves off to the side. So gravity is always acting vertically. So when you move off to the side, there is uneven pressure on joints, and some muscles are overused, some muscles are underused, and the whole body is out of balance. And then the next important joint is the hip joint. Yeah. And I have yet to see one person who actually knows exactly where the hip joint is, because that's the joint that is designed to pivot your torso forward in order to look into the patient's mouth.
Yeah. So you So you think the problem is that we compensate instead of bending from the hip, we're acting like our thoracic spine is a hinge joint and bending forward from there, and that's where it creates a lot of those issues.
Absolutely.
Yeah.
That's exactly it. And also, dentists don't tend to. A lot of dentists work from one position, like 11 or 12 o'clock or whatever o'clock position.
Yeah.
And when people ask me where should they sit, I always say that's an outside-in approach, which is never good work. You need to go from the inside out. You say, given that I don't want to be twisting and bending my spine, and I want to use the correct joints for the job, where do I need to sit? Where do I need to have the patient head turned? You organize everything else according to you working with your biomechanical design.
Okay, so if we're working from inner out, what's the optimum? So for getting the patient, we have our chair and we have our body. So that's, I guess, our most immediate connection. What's the best seating posture that we should be trying to achieve?
The best posture?
Like seating posture, yeah.
Posture, right. So there is no one answer for everyone, because it depends on what quadrant, what tooth, a whole lot of factors. And this is where, of course, the outer ergonomics comes into play. And I call this the inner and outer ergonomics interface.
Yeah.
Ideally, you should be working with a dental chair that is really thin so that you can get your knees underneath. No bulky mechanism for the headrest, because I've seen some that don't allow you to get in underneath. And also you need to sit on a really good stool. So you want to move into a position where you can pivot your torso slightly forward. You need to have your feet on the ground. So hopefully you don't have, some chairs have got a very bulky base, so you can't put your feet where you want it to be. And you want to organize the foot control where you can put your foot on it so that your knee is falling outwards. So there are a whole lot of other biomechanical design.
A lot of factors,
And then you say, okay, now what height do I need to have the chair? And you ideally don't want to have your wrist higher than your elbows. And you say, well, can I get underneath the chair? And some chairs are more bulky on the side. For example, in the 10 o'clock position for quadrant 4 is often a good area to sit. And then you say, well, okay, do I need to get my patient's head to turn? And I recommend to dentists to experiment. Often they say to me, Aniko, especially young dentists, they say, if I spend time moving around, getting the patient turned this way, and then I'll say, oh, do you mind if we turn that way? And they'll think I'm incompetent. And of course, in the beginning, when you look young, you've got to look like you know everything. And I say to dentists, just explain to your patients that you've learned about how to look after your back, and you're just going to spend an extra moment or two to make sure that your patient is comfortable and that you are able to look after this patient for a long time. So communication skills are important here. And I recommend that people spend a few moments to get it right. And often people take shortcuts with their bodies. And one of my mottos is, don't take shortcuts with your body. You only have one precious spine. And the other that you probably have seen me repeat in all my postings is, you are your most precious instrument. Look after yourself.
I think that's so true. And I think the challenge is, especially for new grads, you become short-sighted. You're like, okay, it's just this one time I'm going to like bend over and look to get direct vision. And you lose sight of if I'm doing this for 20 years, what's the effect of like these little moments going to be the cumulative effect on my body? And I think that new challenge, maybe just to kind of sidetrack for a second, is the phones, like the smartphones that we all have, because we're always, even when we're not working, we're still in that posture, our neck's forward and we're looking down. So I think that might be a new challenge that I think it might be a good space. Obviously it's a good space because you're helping us out with this, but we're working all day and then we come home and we're sitting on our smartphones and we're looking down anyway. So it's like the same kind of posture. I think it just kind of accumulates and compounds the issue a lot quicker.
Absolutely. So I'm so glad you asked me this. So incorporated in all my short presentations and lengthy training programs, I talk about cumulative trauma that accumulates at the cellular level every moment that you're doing repeated twisting or holding awkward postures that your body wasn't designed for. And that's called cumulative trauma or repetitive strain injury. And I talk about cumulative trauma in the clinic, but also away from the clinic. And I believe that what you just mentioned, the mobile devices, is one of two main reasons, and we'll talk about the second in a while, the two main reasons why young dentists are experiencing more pain, and there's a higher incidence among young dentists of chronic pain than my generation. When I started running my programs, I thought it would be my generation would be coming. Most of the participants are barely out of dental school. So what happens is, as we already mentioned, the spine doesn't have hinge joints or pivot joints. And most people, young people especially, take their head to the phone down towards their lap, instead of using a wonderful hinge joint called the elbow, which it's not rocket science. And if you bring the phone to you, then you're working with your biomechanical design. If you bend down to look at your laptop or your mobile phone or iPad, you are doing damage, and it's cumulative trauma. The discs between the spine are being squashed and distorted, and that doesn't lead to any good future. So very, very important.
So with regards to the inner ergonomics, I guess, maintenance and strength exercises and things like that will kind of fit into that. So let's touch on that while we're here. What do you recommend in terms of outside of work? What can people be doing to like strengthen their spine or work on their core strength? Things that they can do to kind of delay or try and offset the trauma that they're incurring during the workday.
Right. Well, before I answer that, I do want to recommend that people learn to minimize the trauma even in the clinic. And this is what I teach, practically teach around dental chairs. And of course, that involves breaking habits, and that's a topic in itself. However, there are a lot of things people can do in their daily life to break habits, such as bending over phones. Now, as far as strengthening, unfortunately, you cannot strengthen the spine. So there is a distinction, and you probably know this from your background. There are movement muscles, and then there are postural muscles. There are also cardiac muscles, but we'll leave them out of this conversation. So movement muscles are designed to move, for example, your arm muscles that move the arm and shoulder and movement muscles. And while we're on this topic, I just want to mention that one of the huge issues is that most dentists are not using a finger rest for their non-dominant hand, so that they're holding the mirror.
I do this, I think. I have like the hovering arm on one side of my mirror hand, and that I feel it in my traps and my shoulder.
So what happens, and I'm mentioning this because even without doing any training with me, your listeners will be able to incorporate this and save their shoulder and arm. So what happens is we're holding about a 4 kilo plus arm. The average weight of an arm is 4 kilo, and we're using movement muscles, which are fast twitch for fast action, and then they're meant to stop. And we're using those muscles for prolonged contraction. If I said to you, hold your arm up in line with your shoulder for a few hours, you will have a sore shoulder.
For sure.
A hovering hand holding the mouth mirror is the same. It just looks different. So I recommend everybody finds a finger rest inside the mouth or against the cheek, but mainly inside the mouth, and release the whole arm. So learning to not do things like that is really, really helpful. And then we've got postural muscles, which are slow twitch, and they can fire for a long time without being fatigued. So people need to learn to use the right muscles for the right job. And so there is an activity which I teach in my courses, but also on the homepage of my website, there is something called the active rest, which is a lying down procedure with support under the head, under the occipital bone, so that the head is in a slight forward rotation, and there's a full explanation, and the knees are bent. And it actually allows the spine to decompress because the gravity is taken out of the picture, and joints and muscles are released and unloaded. So that is the best thing to do. And people who have done some training with me tend to take a yoga mat and all the necessary bits to work, and at lunchtime and after work, this is a way of undoing any harmful habits as much as possible.
And just lying there is quite nice and passive, so you can just relax a little bit too. And so I'll put so that's on your website. So I'll put a note in the show notes. People can go check it out.
If you like, I can would you like me to send it to you?
That would be great. Yeah, and I'll post it up or put a link. That'd be great. Yeah.
Excellent, because there's a lot of explanation. There's a lot more than, although it's restful, there's actually passive traction of the back muscles and also the neck muscles that are chronically tight. And there's a absolute decompression of the spine. You probably heard that in the morning we're 1.6 centimeters taller than at night. That's the decompression during the night, where you get that kind of decompression, but it's a passive active decompression. And also very calming on the body and mind. Okay.
Another thing I saw you post, I think it was like maybe a month ago. It was like, and I've been using it since, like, even when I'm like sleeping, I make sure my hands like flat. Cause you always say, like, if you're resting positions, your fingers and hands are curled up. That's not like passive rest. You're still putting stress and strain on the tendons and things like that.
Well, that's still flexion. That's still a contraction. And I see, when I give talks, I always say, now without changing what you're doing with your hand, just look down, and everybody's sitting in some version of contraction. And the contraction is a contraction. And you know that tendons of the muscles that contract the fingers are crossing over in the carpal tunnel, which is a very narrow space. So there's an inflammation. And extending is a really good idea when you can. So put gloves on if you're waiting for your nurse to mix something that's going to take a while, or gone out to get something. For a moment, pop your instruments on the bracket table, and then without touching anything, just do a full extension next to you. And when you don't have gloves on, rest it on a table or on the steering wheel when you're driving and you're stopped at the red lights, any opportunity, or on your lap. And that's a habit I had to untrain myself because I was always contracting my hand.
Yeah, that's a great tip. So let's talk about outer ergonomics. And I guess, the hot topic a lot of people will be wondering about is like dental loupes. So just to share my experience, I bought some loupes in dental school. So they come to the dental school at lunchtime. They got like a typodont. You'll try them on and they'll kind of measure your working length. And and like off you go. And so I've been wearing those, just like a 3.5 magnification oroscopic ones through the lens. So I've been wearing those, I guess, for like 4 years now between dental school and working. And, obviously I've realized in the past couple of years, the angle of like declination is like really bad. So I have to look really down, like beyond the 10 degrees that you said. Our neck is like a hinge joint. So a lot of strain like on my neck and my upper back. And now I'm on the market for a new one. So I thought it was a great time, since you're coming on, to maybe ask you some tips or, brands. Obviously I have no affiliation from my end of things, so I'm not trying to push for any certain brand or anything, but what design options, what brands, through the lens versus flip up, what kind of tips do you have for the young dentist listening in terms of what loupes would be the best outer ergonomically for them?
This is a very important question, and I'm glad we have the opportunity to discuss it. When I first started, I thought I'm just going to focus on the inner ergonomics and, let others worry about the outer. And then I realized I have to get involved in the outer ergonomics, because I check every participant and I go out to dental practices and train the whole team. I'm always checking loupes. And about 2 years ago, I realized that most dentists were coming into, in fact, 100% of dentists were coming into my programs with declination angles that were less than what was necessary to avoid neck bending. Yeah. And unfortunately, oroscopic cannot provide the right angles. So I would say to you, get rid of yours quick, because it's not right. And I actually met just last week with the new national manager of Cable Cure, who distributes oroscopic. I've been trying to educate oroscopic for 2 years, and now I hope they're listening, because it's a problem that they sell dental students hopeless. This is an upsetting topic to discuss for me, because I'm so concerned about young dentists. And so I'm actually in the process of contacting deans of dental schools to alert them to this problem, because oroscopic should not be selling to dental students. And I know I don't, in Queensland, they offer a ridiculous discount, which is irresistible, and it's guaranteed to do you harm. I think that's one of the reasons, the second reason why young dentists are in so much pain. So I have been investigating various loupes, and I've come to the conclusion that I don't have confidence in any through-the-lens loupes at the moment. I don't believe that companies can measure you up properly. You should be looking for about 45-degree declination angle, and most of them can't provide it, and they don't even know. What has disappointed me greatly is that most companies who are providing loupes have no idea about biomechanical design and the fact that you are not supposed to bend your neck.
Which is quite surprising. You would think they would invest a lot of money in the research and development.
Exactly. So at this point, what I would be looking at, if I was looking for something myself, is adjustable loupes that are able to provide you the right angle of declination. And the two that I've been investigating, and by the way, I refuse to be associated with any company. Many companies have asked, and I said, no, I need to be totally independent, because I would recommend based on good ergonomics, not because I'm paid for it. So I have no financial involvement with any dental company for that reason. So Heine and Surgital are the two that I've been looking at. Heine has got better adjustability that doesn't depend on nose size. And I didn't realize this until a friend of mine had a problem with Surgital and his lovely non-petite nose. And so Surgital has got different kinds of adjustable parts, and I believe that you can get the full adjustability, so about 45-degree angle. And I should mention this, that unless you are, and I'll come back to Heine, unless you're using operating microscope or loupes like Pentax, you cannot sit upright and hope to look into a patient's mouth without pivoting slightly forward at the hip joint. This is a major, you know how we talked about what people don't know that they don't know. This is that area that you cannot sit upright and look into a patient's mouth without injuring yourself.
Is Pentax the one with, it's like a mirror, so you look straight in the loop and it reflects down, or?
Yes. Yeah, so it's almost like an upside down periscope. You can sit upright, just like when you're looking down into a microscope, you can sit upright and look into the patient's mouth.
Wow. Do you recommend that one, or?
Pardon?
Would you recommend that one? Like, do you have much good experience with it, or?
Well, I'll talk about that as well. So the product itself is good. It's distributed by Dental in Australia.
Mm-hmm.
And the benefit is that you can sit upright, look into the patient's mouth. However, you need to move the patient around a lot like when microscope users have to.
Yeah.
And now the company reps, Dental, are not that highly trained. I think they're better now than they were 2 years ago.
Yeah.
And I don't know if you saw on DPR, there were a number of postings about people having very positive and negative experiences and poor after-sales service.
Yeah.
Overall, the product is good. The after-sales service by Dental is not so great.
Yeah.
And that's the company, I was told by the Dental reps at the recent Adelaide Congress, that I think it's a Japanese company, doesn't care.
Mm-hmm.
So, but the product is good.
It's good, yeah.
And the one that I would be possibly looking at, you can get the through the lens type, and you get lenses that are not great for eye safety, to say the least. And so what I would be looking at is wearing safety glasses or your own whatever prescription glasses, but with a safety frame. Mm-hmm. And then you can get this bar, and I think you'll find that really helpful, is there is just a bar, and it's like glasses without any lens, but no bottom part. And then it's got the flip-up version of the not orthoscopic, the Pentax, which means that you can actually get it out of the way. You can wear whatever you need to underneath. Doesn't depend on what shape nose you have. And that's the one that I'd be looking at.
Okay, that'd be good. So the main three overarching style you recommend: flip up, adjustable versus through the lens, which makes a lot of sense because depending on your posture, depending on how you're seating, and whatever else works for you within the workflow of your space, you can adjust it if you need to, which through the lens is kind of limiting.
Well, absolutely. So when people come into my courses, even the people who are wearing adjustable loupes, it's not adjusted properly, and then I just get them to fiddle until it's right, whereas if it's through the lens, you can't do anything.
Yeah,
I always sell it secondhand to a jeweler or a dental technician, because if the work is in front of you, then you can work with shallow declination angles.
Yeah.
Even once you get the adjustable hiney or surgical, you still need to adjust it because it doesn't come according to what you need.
Yeah. And with the Pentax ones, have you found there to be a big learning curve? Because obviously you said you're not as flexible you just have to adjust the patient to kind of get the visual field that you need.
So I have looked into the Pentax, and I have had it fitted to me to see what it's like. But I've had a lot of feedback from dentists who are using them. They said that there's probably a week or so of getting used to it. Same with microscopes. It's a bit longer there.
Yeah.
There's a little bit of a learning curve. You just have to move the patient. And by the way, I recommend that even without Pentax or microscope, move your patient so you don't have to twist yourself into a pretzel.
Yeah.
But you have to move your patients more. And of course, while we're talking about loupes, I really want to talk about eye health. Yeah. Please, everyone, take your glasses, prescription glasses off regularly, and also the loupes regularly, because you need to look near and far, use your peripheral vision, look at natural colors and light. I know a lot of people who wear their loupes all the time. They even go out to see a patient in the waiting room wearing their loupes.
Oh, wearing it.
Want a break.
Yeah, for sure. It sounds all it's a very physically challenging job. There's so much I guess they always say it's one of the most hazardous jobs because of the materials, the sounds, the light, the posture. There's a lot that we kind of have to take on in our given day, and our bodies are kind of going through the ringer, just being a dentist. So
absolutely. And may I mention one more thing that most people don't know about, and this is and again an inner and outer ergonomics interface. If there's any young dentist working in a practice where there's not enough room behind the head of the patient chair,
that's a huge problem.
it's a huge problem, because I don't know if you saw me posting about, is your surgery safe for your back?
Mm-hmm.
I did a posting on DPR a while ago. So when the patient chair is fully supine, there should be enough room. There should be, you can measure it, there should be a minimum of 70 centimeters, 70 to 90, taken from the edge of the headrest to the wall or the cabinetry. If it's less than 700, then 800 is a better measurement, but minimum 7, it means that the dentist can't push back the stool far enough in order to bend forward slightly at the hip joint, and you've got to do a C-bend with your spine. And unfortunately, the Dental Association has no guidelines for that's a critical measurement, and they've got guidelines for everything, including the kitchen sink, but not for that. So I'm advocating for the inclusion of that.
Yeah, that's important.
Sorry to interrupt, but I was just going to say, I have recommended one dentist who I found out didn't have enough room. I said, you need to leave. If your employer cannot change, you have to leave, because it's a career suicide.
So when the chair is fully supine, from the tip of the headrest to the cabinet should be at least 70 centimeters. Is that right?
Yeah.
So 0.7 meters. Because that's an issue. I mean, especially being left-handed, because the chair's always often on a bit of an angle. I find like the back of my chair is always rubbing up against the cabinet. So I have to measure that.
If that's the case, and I know that good jobs are hard to come by, but there are jobs, and there's only one precious spine. So if they can't change, don't stay.
Yeah, for sure. And that's why I think it's so important what you're doing. Is I'm a big believer, and I tell my wife this all the time, is, fast forward 30, 40 years with the medical advancements and everything, they might be able to cure disease, and they might be able to, offset those things. But I think our like musculoskeletal system is something that you can't fix with like a pill. Like if your posture is bad, if you've already messed up those things, that's not something that can be easily fixed with technology. So I think that's the one thing I tell her. I'm like, we got to make sure at least our posture is good. Okay, if I get diabetes when I'm 60, that's fine. I'm sure they'll have a cure by then. But my bad back and my bad neck, there's not something that's going to be easily fixed.
Well, the good news is that I was already in my early 50s when I finally, early to mid 50s, and I'd been in chronic pain for over 30 years. And when I finally learned that it was the way that I was bending over my patients and lifting my left shoulder and elbow and all those things, that's what was causing my problems. And I tried everything to get help, all specialists and physical therapists. It was possible to get well once I transformed those terrible work habits. So there's always hope, but the earlier you learn, and I'm delighted to be interviewed, especially because you said that your audience are young dentists. I'm delighted to say what I've said so far and recommend that dentists train further with me, because if I would have known just a fraction of what we discussed already today in this interview, I wouldn't have suffered for over 30 years. And it's so simple. I wish we could learn this in dental school, and I'm trying to get into teaching.
That'd be so valuable to have that as a subject, to like introduction to ergonomics and those things, because it makes a big difference, and it affects your mood, it affects your productivity, it affects your longevity, obviously, in the career. So taking care of yourself is pretty important. With the podcast, we like to be pretty practical. So I'm going to put you under the pressure a little bit. So if you can give me like 5 things for inner ergonomics that someone listening today to the podcast can go to work the next day and kind of be mindful of or put into practice, what would they be?
Right. So just watching you trying to upright yourself, what you were doing was using movement muscles. Yeah. And so by pulling upright is unsustainable. So that's not going to work. It's very important to sit on your sit bones on your dental stool, and ideally you should have a firm seat, and have your feet on the ground, the foot underneath your knee, and also the knees slightly outwards. And you need to think, this is called directional thinking, which takes a lot more time than this. But if you can just think that your sit bones are going through the seat and your spine is going upwards, but don't pull yourself up, then you're activating postural muscles.
Okay.
So
just to clarify this, so if I'm actively pushing myself up, I'm using it's not my just postural muscles. Okay.
And that's not sustainable.
That's a great, I've never thought of that before. So that's really good. Okay.
Well, no one knows this. So this is part of the, and then know that you cannot sit upright unless you have got Pentax or a microscope. So you need to pivot forward slightly at the hip joint and then look down from the top of the spine. Unfortunately, if you've got the wrong declination angle, then you can't do that.
There's no hope. Yeah.
And don't pull the shoulders back either. If you think of shoulder away from shoulder, but don't move anything, you actually you're sending message to the motor neurons to stop the trapezius from firing, the upper trapezius. So this is directional thinking. Use indirect vision. There are very few places where you can actually see into the patient's mouth without twisting your spine. I recommend double-sided mirrors. Have you heard of double-sided mirrors?
I've seen them, but I haven't really used them. Not many people have those. So
most people have never heard of it. Now, this is a very big piece of instantly usable information.
Yeah.
When you're retracting, you either lose the single mirror side, or people have shown me how they retract so that they don't lose their one side. And you've got to use a far bigger motion with your elbow and shoulder in order to not lose your one mirror. Yeah. Whereas when you've got a mirror on both sides, you can actually allow your shoulder and elbow to be released and just use your hand. So I recommend to go out and get the double-sided mirror. So I don't get any commission on this. And in fact, any dentist listening, if you call Henry Schein Hallis, they are the distributors for Hugh Freddy, and say that Dr. Ball told me to get this, I believe that you may be getting a 20% discount.
Oh, nice. Okay.
Nordent also makes double-sided mirrors, which I think are cheaper. I'm not sure how much of a difference there is in quality, and that's solves one dental. Mm-hmm. And also, another very, very important practical advice is that if you're reaching to the side, for example, if you've got a delivery system that's just a little bit off to the side and you want to pick up or put down your triplex or your instruments or your handpieces, instead of doing a twist to the side, which is a repetitive twisting that's very harmful to your spine, you pivot. You're sitting on chairs that pivot very easily, the dental stools. Do a whole body turn, and then it's not going to accumulate trauma. So use your whole body. Don't take shortcuts where you just twist off to the side. Just pivot off to the side and then pivot back with your whole body. If you can use the motto, all of me, when you do something instead of just twisting one body part, same in extraction. If you think all of me rather than just my arm extracting, your whole neuromuscular firing system coordinates differently. Okay,
that's great. So before we wrap up, let's talk about your Optimum Dental Posture program that you're running. How does it work? Is it a one-off course or is it a continuum of courses? And what's the best way to people to get more detail about it?
And thank you for giving me the opportunity, because that by people attending, I run a 2-day ergonomics and wellness in dentistry program where I teach how to overcome and prevent occupational chronic pain and also stress in dentistry. And we touch on taking care of the mental, emotional wellness as well as the physical wellness. And of course, it's inseparable anyway.
Yeah.
And I've done that over 2 days in Melbourne, Sydney, and Brisbane. And in fact, my next Melbourne program is in July 25.
Okay. Yeah.
And I highly recommend it, not because I need more people, but because that's the best way for any dentist to learn the basics. I teach the ABC of inner ergonomics at Henry Schein Hallis. I use various dental companies' showrooms wherever I teach, because I like to teach the basics in a seminar room space. And also we do a lot of movement. I get people to lie down in active rest many times during the 2 days, so they learn it experientially. And then I take them next door around dental chairs with mannequin and we practice how to apply what they just learned next door
That's great.
simulated dental activity. And we look at absolutely everything. On day 2, we look at how to stand and bend and do extractions and how to not strain your arm when you're extracting. I get people to bring in instruments. So that's the foundation training program, and I highly recommend it. I've got one in Sydney at the end of this month, which is almost fully booked now. I limit it small numbers so that people get a lot of direct experiential training, and I have assistant trainers, and we give kinesthetic guidance to each person. I also go out to practices, and I run a half-day training program and train the whole team, and each person trains in their workstation, and that's very useful. And I offer follow-up programs over time as well. I'm currently working on some online training programs because I have dentists who are far away, and
that's really good. Yeah, I think the online space is definitely useful and valuable. Obviously, you don't get the direct, person-to-person connection or the hands-on kind of teaching, but it just frees you up because you don't have to take time off work. You can just kind of fit it in over a weekend or in your evenings. So I think it's a nice complementary kind of service to offer. I think, you've certainly found a nice niche and a very valuable, aspect of dentistry that's really overlooked and not taught really well. And, as much as, we take courses and improve our skills and everything, if we're not healthy and if we're not, happy in the workplace, then our longevity and our production is going to drop for sure. So I think it's certainly something that I'll definitely come check it out. And I suggest other people do as well, because I think, these little tips and things that you can learn, and it can really save you in the long term and save you a lot of money, maybe in physio and rehab costs as well. So, so I think prevention is always better than treating, right? So,
well, I must say that unfortunately, most young dentists are already past prevention. They're already suffering. So this is the way. Yeah. And this niche found me because I suffered for so many years, tried everything, spent an absolute fortune, time, money, and energy. Yeah. And all I got was symptom relief. No one actually looked at what I was doing. And it wasn't until I came across the inner ergonomic principles of the Alexander technique, which is literally the user guide to this body that we have in motion and postures, that I got well. And I was never going to teach this. But then after 3 years of being well, I thought I need to further train. And I trained for over 1,600 hours in person, over 4 years part-time, in order to teach this. And then I translated it into industry-specific application. And so I'm so passionate about saving other dentists from suffering the way I used to. And I was really crippled up to 11 years ago, that I am driven by this passion. So I didn't look for a niche. I didn't look to do this. This found me. And then the passion drives me to save my colleagues.
That's amazing. Yeah. When you find your calling and your purpose, it comes naturally almost. So I think, it's great that you found that. So before we wrap up, I always do just a quick rapid fire just to kind of line things up a little bit. So what's your favorite pizza topping?
Pizza topping?
Yeah.
I'm vegetarian, so cheese and tomato.
Cheese and tomato. What's your favorite musician or artist or band?
I love classical music, so I've just been listening to Yehudi Menuhin playing a beautiful violin concerto. And
I guess you're not practicing anymore, but when you were, what was your favorite tooth to work on?
Stentrals.
Stentrals. Nice and easy ergonomically.
I only started practicing about maybe 2 years ago. I was planning to continue part-time practice, but this inner ergonomic work and optimum dental posture training has taken over so much of my time. I thought there are enough dentists saving patients and nobody is saving dentists. So that's my calling. Yeah. And something I forgot to mention is that on my website, optimumdentalposture.com, is where people can find information about all the programs and any other information.
For sure. I'll put a link in the notes as well. And the final question is, if you weren't doing dentistry, what career would you be in?
Well, I love what I'm doing now. So this feels my calling. I certainly love my dentistry. Yeah. I was very passionate about, I was in the latter years practicing in periodontics and also in dental sleep medicine, and I loved both. So this was a calling, as you said.
Yeah.
What I'm doing now.
Okay, Dr. Aniko Ball, thank you so much for coming on. I think you shared a lot of valuable information. Obviously, audio and podcast may not be the best format for talking about ergonomics and things because you need to show examples and movements and things like that. So I will definitely put the link to your program and your course in the show notes, and people who want to learn further can definitely check it out. And I think it's valuable. I learned a lot of stuff today as well that I can kind of apply, and I'm excited to sort of hopefully attend one of your courses in the future and learn some more. Because for me, I think a lot of millennials as well, we value health a lot. I think health is very important to us in terms of maybe more so than like objects and goods, like instead of like a nice car and things like that. I know a lot of us think this way, that we want to be healthy and have good longevity and things like that. So this fits in perfectly with that.
Well, thank you. It's been a pleasure talking with you about this very important topic.